helping survivors regain confidence and thrive. We are in the midst of Breast Cancer Awareness Month, and we're talking with experts from Crystal Clinic plastic surgeons. Today, joining me in studio is board-certified plastic and reconstructive surgeon, Dr. Derek Cody. Thank you for being here this morning.
Pleasure.
We're going pink all month long. I'm so excited for our pink runway event taking place. And so many of the women who show up every year to be part of this, they've had different types of surgery done. And that's what I think is so wonderful. There are really so many options out there for women. And one of the things you specialize in is DIEP flap surgery. And for those who don't know or might be initially going through this, can we get into what that is first of all?
Absolutely. So the DIEP flap is one of the advanced forms of microsurgical breast reconstruction. It allows me as a plastic surgeon to recreate a breast from the tissue that we typically have below our belly button. That's some tissue that closely mimics the form and texture of a breast, and I can transplant that tissue to the chest to make a warm, soft, natural appearing breast reconstruction. This technique is the state of the art. It's certainly the gold standard for autologous breast reconstruction, but it does require a plastic surgeon who has experience and expertise in microvascular surgery so that we can connect these blood vessels that usually are a few millimeters in diameter with sutures that are smaller than a strand of human hair and do it with a high level of success.
The intricacies of it all is just incredible. Who would be a good candidate for something like that? Could anyone do that?
Absolutely. So anyone who's had breast cancer and had treatment with a lumpectomy or a mastectomy is a candidate for autologous breast reconstruction. Patients who have radiation. In my practice, I tend to do more autologous breast reconstruction just to avoid some of the complications that we can see with implants and radiation. Also, patients who've had implants in the past and for some reason or another, things didn't work out as planned. So
that probably will lead into my next question of the advantages of doing something like a DIEP flap surgery. What would you say to that?
So the advantages are this is a lifetime reconstruction. It's warm, it's soft, it has a blood supply. It doesn't have some of the maintenance associated with an implant. There's no long-term changes because of age or rupture. We also can maintain the core abdominal wall function so that patients can have faster recoveries, continue to lead active, healthy lifestyles, and again, we can often recontour the lower abdomen, much in the way we do for tummy tucks.
And I think if someone, and I'm glad you mentioned, if someone has implants already and they don't, for whatever reason, it's not working for them, I think it's a good reminder to realize there are these options out there. You can have a second surgery that might be better for you or better fit for you.
Absolutely. So these options are available to women. Thankfully, through our advocacy, we've helped pass the Women's Health and Cancer Rights Act, which says you have access to breast reconstruction through your insurance, and that's been around since 1998. However, we noticed that there was a gap in women accessing care, so we pushed for the Breast Reconstruction Awareness Act, and this requires doctors to let patients know early on that they have access to these options. They don't expire, and sometimes you need a change.
Well, I know in the very beginning, when you're diagnosed and if it's something that if you can have surgery right away, it's overwhelming. Mm-hmm. So what advice would you give to women out there as far as, making sure they're doing what is right for them?
So my advice is really, you're your own best advocate. Research your doctors, make sure they have the expertise and experience that you need. Have multiple visits with them. There's a lot of intricacies that we need to explain, and it takes some time to sort of gather all this information. If you need a second opinion, sometimes you have to take the bull by the horns. Mm-hmm. and go look for a second opinion if that first fit just wasn't right. Bring family, bring friends to these conversations so you have another set of ears to help decipher all this information.
I do think it's true, like anything else in life. Once you find peace, you'll know, and if you have a gut feeling that something's not right, get the other opinions. Mm-hmm. It's so important. Now, I'm excited. I know we'll be back together on the 23rd, Wednesday, October 23rd, for the pink runway. Crystal Clinic plastic surgeons do this up every year. It is always so amazing to see these wonderful women shine, and it is your chance to come and support them. So you can go to crystalplasticsurgeons.com/pink-runway and get the tickets, join us. It's going to be a wonderful evening. I can't wait to see you all there. I can't wait to see you there.
Looking forward to it. This is certainly one of the highlights of our year.
It really, and mine too. Thank you so much for being here, Dr. Cody.
My pleasure.